Because, you know, Gerald is not with me, but I wanted just to associate him during this lecture. So let's go to the second topic, because we have to go fast. We have many things to do, but the time is very short. And as you know, since a couple of years, the word topic is very trendy, because it is at the middle of the aesthetic, it is at the middle of the biology, and at the middle of the function. It concerns many things. And also, when we will look at this young guy, because the challenge today is to be able to treat young patients, because where is probably the decay of the next century for us as a dentist. So we need to understand it perfectly. So the challenge is, in one hand, the tooth structure are okay, but there is no decay. In the second hand, I want to redesign the smile, because it doesn't match with the face of my patient, and he wants to redesign something. The question is how it's possible to find this balance. And what we know from the last 5-6 years, and we need to insist about that, was the work from Francesca Vailati from Geneva, because she completely changed our way of thinking concerning this treatment for worn dentition. But also, as a teacher, I could say that one of my questions is it always, that technique, is it always feasible? Is it always teachable? Is it always repeatable? And we wanted to simplify a little bit the workflow of this treatment in order just to be catchable by most part of the dentist, and not to stay in a very high level things, because at the end, all of the dentists need to be able to take care of that kind of patient. So the first thing is, we need to increase the video, not for aesthetic reason, because of just for the biology. If you want to increase the video, for that case, this is not because of aesthetic. We just want to create space, to create a new morphology, and without cutting the teeth. And for that, simply, we have just to apply some 2 spots of freehand composite on the 2 palatal area, and we fix it with the light cure. And after that, if the thickness of the other restoration, if the available space that we have created is okay for my future morphology, then I can fix it with my bite registration, and I am able to send it to my technician. Other information precious. This is just a small video in order to see how we play with that. We check the bite, and after that, after the light cure, we ask the patient not to play it in a centric relation. When you have no pain, no pathology, just ask the patient to bite in the normal position. Why do you want to deprogram if everything is fine? And then we fix it, and we are able to send it to the lab. The problem of the increasement of the video was, you know, always something very complex. But at the end of the story, we know that this is a very safe technique. And also, we need to record the most important references of the face, which is the interpupillary line for the horizontal part and the medium axis. And you can play with that kind of device. The name is Dytramax. It was made by one of my colleagues in Marseille. And after that, Hilal, because this is a case that I did with Hilal Kouday from Istanbul, was able to provide a wax-up, because he has all the information enough precise to produce exactly what I want. But the tricky point for me as a dentist, okay, I have a perfect wax-up, but how it's possible to transfer a complete wax-up in my mouth by just placing a silicone index? It's complicated. So we use a technique just by scanning the wax, and then with a special software, we apply a simple layer of resin photomer. And after that, we ask the 3D printer just to make that kind of resin template. And we reline it with a light body silicone in order to have an unbelievable fit with the initial situation. Why? Because if you have an important friction on the buccal and the palatal part during the insertion, then it means that you will have only one possibility during the insertion process of the template. And it means that when you will fill this template in the mouth, you will get directly in 2 minutes a very accurate mock-up. It means that you have in 2 minutes an aesthetic mock-up, but also a functional mock-up. And you will understand why this mock-up is so precise, because we are able to draw the future through it. And even if sometimes the first aesthetic try is not correct, just with a flowable composite, you have just to add a little bit, just to lengthen a little bit if it was not enough long. And after that, the most important thing is to keep it in the mouth, because we will use it as a guide for the prep. And this is something that we need to focus, because we have two main questions when the mock-up is placed in the mouth. The first question, me as a clinician, is, okay, how deep will be my cut? Because I don't know it. And the second question is, which design for that kind of restoration? And concerning the depth, how can we control it? We know perfectly from the work of Galip in the beginning of the notice that it's possible just by creating the right thickness. We need 0.5 millimeter to create a laminate. We need 0.5 millimeter to create a tabletop. So just use the burr and you make the groove. But at the end of the story, I strongly believe that I don't see any kind of future if in our daily lives there is no guide. We need to follow the guided dentistry. So when you are guided, you have the seat belt. So there is no danger. You control exactly what you want. And after that, this is a technique that we have published now in different articles, and also that will be published in other option, in other review. This is just a simple movie to see that at the same appointment, I repeat, during the same appointment, we treat the global arch. I mean, we make the prep for the buccal laminate, and we make also the prep for the posterior tabletop, following exactly the same concept, the same tools. So it's something which should be very easy. You don't need to block 1 day of your office just to make it. You can do it in 1.5 hours, and sometimes it's without any kind of anesthesia. Because at the end, you cut the mock-up, you touch the mock-up, but you will see that you don't touch the tooth. This is the difference. Why? Because you think from the future, you don't think from the initial situation. It means that at the end of the story, if you look at the grooves here, what happened? Nothing, because you didn't touch it. So, concerning the design, it's important also to point out some things. Now we are faced with a reduction of the design. We went from the overlay, but with some mechanical problem, because we destroy all the marginal ridge, all the LC marginal ridge for no reason, just because we wanted to adapt to the material requirement, which is not logical. The material needs to be adapted to our biological requirement, and this is not at all the same. And this is why, according to the level or to the severity of the wear, you will have to modify your design inside or outside the cusp. It will depend on the initial situation. But at the end of the story, the prep will be prepless, or in the palatal area, for example, almost no prep. You just need to make a small point with your burr in order just to stabilize your palatal laminate. And from that, we did a study to know if there is a danger to play in with that kind of design, and we compare it with the classic overlay. And you can see that there is no significant differences statistically speaking, you understand? Because at the end of the story, with a lower biological cost, you have exactly the same fracture resistance. This is just something that we need to think about because this is the truth. And then when we go back to the lab with Hilal, then what happened? We know only one thing, even if I love the ceramist. The future of the dentistry and of the lab also will be just to press and to stain or to mill and to stain. And the material like IMAX today is able to cover 100% of that kind of things. And you can see that for the functional part, we are able to mill this palatal laminate with IMAX CAD, for example, in order to produce first all the functional part. And after the centerization, this is the new pictures. And then it can focus on the anterior part, the aesthetic part, because the sandwich is used for the 10 anterior area. This is a sandwich. This is not the same restoration. This is both. Why? Because when you had two, you have not to cut the teeth. If you want to make only one, it means that you have to cut a lot. And again, if this is my daughter on the chair side, I don't want to do it. And then, from the milling process, we were able, to go from 0.5 millimeter, because this is the maximum of the capability of the machine, to 0.1 sometime, but by handling. I mean, he has to cut it at the lab. And he used a special mark in order to be sure that he won't create a hole during, the polishing process, because polishing at this step is very delicate, and if you want to avoid a big problem, you have to polish very, very slowly. And after that, you are able to provide something nice, and this is exactly what I want, the sandwich concept, which was proposed by Francesca a couple of years, but with that kind of easy material. And then we have to take care about the cementation. And we want to simplify the workflow of that kind of treatment. We want to simplify the clinical step. It means that we want to glue at the same time the buccal laminate and the palatal laminate in order, to be able to treat the one archie completely in only at the same appointment. And the same day, if you have enough time, because you have not a lot of things to prep for the lower arch, then after the end of this cementation, you will be able to take care of the lower part. So again, we sandblast, we use the rubber dam one by one, always. This is just 6 different movies, just to show you how repeatable is the concept, how repeatable is the method. And this is the power of the method, because you can manage it. You know that this is between 7 and 10 minutes for each cementation. And this is an unbelievable tools from Ivoclar. This is not because we are in Ivoclar event, but this is a crazy things and absolutely delicious Optrasculpt. You need to think about it. 2 minutes, it's okay, Mr. Chairman? Okay, perfect. So this is the final functional area for the upper part. Then, as I told you, we just need to take care after that of the lower part. If I have one advice, don't try to treat at the same time the upper and the lower arch, because this is too much delicate and you will have too many problems for the controlling of everything. And we go exactly in the same direction, following the guided dentistry.